Here in Bozeman, we can treat probably 95% of the different cancers that come here. But there are some patients that we just can't take care of here in Bozeman. So we've developed an affiliation with the Seattle Cancer Care Alliance. The affiliation isn't just for when we refer patients there. It also helps us if we have questions about particular patients, or if a patient just wants to have a consultation somewhere else, we can refer them to these doctors that we've developed a relationship with. They have a lot of different research protocols, so when the initial standard therapy for a patient is no longer working, we have access to the latest pharmaceutical trials that we can offer our patients here in Bozeman. When folks have a diagnosis of cancer, usually they're scared. And sometimes it can be a very dire prognosis, and other times the prognosis can be very, very good. And really my most important job is really not the radiation treatment. My most important job is to convey information to the patient, meaning this is what you have, this is what I think your options are. And then the person takes that information and talks it over with their family, and then they try to make the best decision for them. And what I love the most is when my patients tell me, thank you, doctor, for being honest with me, for really helping me to understand what I have and what the impact is going to be on my life. I have a team of people. I have a dosimetrist and a physicist who help me develop the radiation plan. And then generally we have to do some quality assurance work to make sure that what we're seeing on our computer monitor can actually be delivered by our radiation machine. Sometimes the workup of a patient is pretty straightforward, but other times when the workup and evaluation of the patient is a little more complicated, or if it doesn't fit neatly into a particular box, then we'll talk about those patients at what we call our weekly tumor board. We typically have some of the general surgeons, the urologists, radiology, medical oncology, radiation oncology, our social worker, our spiritual care. And basically what we do is we just put our heads together and review the entire case, look at the x-rays, look at the actual pathology slides, and then try to formulate what the best plan is for the patient. Because it's not just about curing the cancer, it's about giving the patient the best quality of life in the long term.